Hi, this is Dr. Nikitow. Welcome to another edition of the Chiropractic Approach. And what we're going to be talking about today is a lot of neurological imbalances, neurological deficits that could come from a lot of different types of things. Some people that have neurological diseases, some people that have interferences to their nervous system that appear like they wouldn't be able to be fixed. Well, we've got a patient over here, Roxanne, and she's going to go ahead and tell you a little bit about some of the stuff that she came in with initially, and then I'm going to show you how we worked with her gait. We're going to talk about how her coordination improved, how emotions improved, just basically how a lot of different things improved based on some of the things she came in with. So, Roxanne, why don't you just tell everybody a little bit about what was going on with you initially?
Okay.
Yeah.
I had been going to the chiropractor all along for 2 years anyways to try and help myself with numbness in my hands that I had had. And I had some success, and I was entering into a maintenance program. But I ended up with a infection that abscessed in under my skull, and because my skull is hard, it didn't have anywhere to go, so it smushed the part of my brain that controlled the whole left side of my body, and I had to learn how to do everything with my arm and my leg and my waist and everything again. And I got the kind of therapy they give, and I was working on it, but it just wasn't making any progress with the chiropractor that I had. So I decided to come to Dr. Nikitow, and he has really helped me gain a lot of what I lost. I had to create new pathways for my brain to think, because that department was out of business, and all the other parts of my brain had to take over the work that the old department used to do. And it takes a while to create those pathways and a lot of repetition, and I was afraid I was going to get into the wrong mode and the wrong rut. So I've been working really hard on it, and I feel that I am so much more improved. I may never be 100% perfect because there was a lot of damage done in my brain. However, I know that I can continue improving all along, and I'm better than I was. Much better, even just 6 months ago. I see progress all the time.
Yeah. Let me explain a little bit about, let me use a neurological term that's called morphologic synaptogenesis neuroplasticity. Now, that's
I know the plasticity.
That word's about this long, okay? But basically, what she's talking about as far as retraining and relearning, let me explain something. Your brain and your nervous system has the ability to relearn, and they've discovered this in the last how many years, and there's a lot of neurological research that's been done in this. Now, I teach a course in chiropractic called articular neurology. It's how the adjustments affect the rebuilding of nerve structures. Okay, and it's really important you understand this, because with the system we use in our clinic, we can actually do patterning types of adjustments to help retrain the nervous system to start rebuilding itself back in those areas. Okay, because again, when a patient like this has problems with the brain's trying to hook up and trying to send messages out to the periphery. Now, when you came in, you didn't have as good a use with your arms. Your legs were, your gait was really, really off, and you were really having a struggle kind of even walking. You had a lot of numbness and tingling, I remember. But in addition to that, you mentioned you had neck pain and, of course, back pain. And what's happening here is the body's trying to struggle so hard. Remember, it's not muscles. Muscles have no brain, okay? But the brain has to signal through the nervous system and tell the muscles what to do. Now, in a case like this, what happens is the nerves aren't firing correctly, so that the muscles aren't pulling correctly, so the spine gets pulled out of alignment, or what we call subluxation patterns. So we had to do a lot with Roxanne in terms of her neck was not curved right. It was too flat, and it was compressing here and tensioning her spinal cord. So that was affecting the nerves that came out of here, went down to her arms and hands. We also affected the lower part of her back, which is shifted all the way over to the side, and so we had to bring that back into alignment by doing repetitive adjustments to one side. If you go to a chiropractor, you have to go to somebody that's doing what's called a three-dimensional Cartesian coordinate system. What this does is it helps us with, if the pelvis is too far here, we have to do just adjustments to one side. If it's twisted, we have to untwist it this way. So you don't want to go to somebody who's just doing, you know, balanced adjustments or things like that until the spine is back into its proper alignment. Okay, so basically, let me ask you a couple questions too. So you had some of the numbness and tingling, and that started to go away. The strength started coming back. You also had some emotional imbalances. Why don't you tell them a little bit about that in terms of some of the stuff that was going on, because that can affect that too.
People that I had known for 5 years at work said that I was different after the brain thing, and I didn't believe them. But when I started coming into Dr. Nikitow, he would detect something. He'd say, how are you doing today? And I'd be, I'm fine. But obviously I wasn't fine. So he would check something called switching, and he would fix me. And I would walk out of here and within 10 minutes feel better. And it got to the point where I would be able to come in and ask him, am I switched today? And I think in the last couple months, I haven't been, even when he's tested me, I haven't been switched. So I'm a much more even-keeled person. I also had, in the last 5 months, had to learn a whole new system of a computer at a new job, and it was very awkward for me in the beginning, but it started to flow, and I learned it as well or better than some people. And so I think that I'm not thinking straight like I used to, but I'm still doing fine.
Okay.
I just feel better about tackling new things.
Sure.
You've also helped me with my balance when I walk
Sure,
and
physically.
when I stand. And
Sure.
I've come in and told you a lot of things that I can do now, including run. It's an awkward looking running, but it means that my brain's firing faster and thinking a lot faster for me to be able to even move
Attempt to run, yeah.
yes.
Yeah.
And so I'm able to think faster and make my body do things faster. I can do alternating motions better than I could before.
Right.
Because I couldn't do the same thing on both sides.
Exactly. So you're firing the nervous system better since we've been working on you. Let me explain a couple things. First of all, what is a switch? Neurologically, the brain has two hemispheres, and they should send messages to the opposite side of the body, okay? We have a dominant hemisphere, a subdominant hemisphere always, so we have a dominance in the right hand, left hand, things like that. Now, in a switching pattern, the neurology gets mixed up, okay? So it's sort of like the body gets mixed up in its delivery of its messages to different parts of the body. Neurologically and emotionally, you can have problems with trouble concentrating, moody, depression, trouble sleeping. You'll wake up in the middle of the night, you'll walk into a room, you don't remember why you went in there. You'll just feel out of focus, okay? You'll feel like foggy thinking. People tend to get a lot of this and they think they're just under stress. Well, stress is one thing that'll cause that, but switching is an actual neurological overload where it's sort of like when the computer all of a sudden freezes and then you have to reset it or restart it, okay? So what we do, and I'll show you a technique that we do to clear switching, but this is very common with people who have ADHD, dyslexia, bipolar, apolar, patterns here where a patient may have had some brain injury, things like that. So what we do is we actually do a patterning exercise, which was developed by a man named Nikitow out of Pennsylvania, who's a PhD, and he's done a lot of work with patterning exercise and repatterning the nervous system. Well, we do that in our clinic, and we give the patients exercise that they can do at home. It's extremely effective. We've helped all sorts of patients with ADHD, dyslexic patterns, things like this, and this is why her coordination of her nervous system to her limbs and things is a lot better, but also is her mood, also is the normal overall wellness, the function of the body, so the body feels more well. Okay, take a walk back maybe the way you used to walk. Now watch if you can identify, look at her arm movement. Okay, now come back. Okay. Okay, now what we just observed is when we check a gait pattern, what you're checking is to see if the nerves are firing correctly. Now, one of the things you'll notice is that when a patient has misfiring of the gait, they'll usually swing one arm more than the other, okay? What that means is that they're taking a stride longer on one side than the other, okay? So when we go to take a look at Roxanne, we'll notice that we had one arm moving and the other arm wasn't moving. Did you notice that? Okay, now, earlier on in her treatment, she had a lot of that where she was just moving one arm and not the other at all. Well, that means that her one leg was moving further than the other. So a lot of times, like for instance, if we have football players or athletes, when we work with pro athletes, we'll look at linemen and they'll come off of one side and they'll always do the same thing over and over again. Well, they're going to end up with a longer stride on one side than the other. What happens is, and symptoms of this are, that if you are just basically walking, you're going to feel your back tighten and tighten and tighten the more you walk or run. Now, if that's happening, you have a gait problem. If you're going to a chiropractor, they need to do an exercise that manages the gait. And what that exercise would be is once we identify which arm is going further forward than the other, then we're going to accentuate the other side by doing an exercise of, let's say your right arm is not moving as far as your left arm. So what we're going to do is we're going to do an exercise where we're actually moving the right arm and left leg more than the opposite side. So you're actually going to walk like that for like a quarter mile, okay? Okay, so now in Roxanne's case, what we noticed with her when we, number one, saw her walk, and also when we did the test on her for what we call a gait pattern, we noticed, okay, that she was walking with a longer stride on her left leg and right arm. So we gave her an exercise to accentuate the left arm and right leg. Okay, so lay on your back for me and I'll show them how I did the test. So doctors, you can know how to do this, okay? So typically, here's the deal. Okay, so she was walking with a longer stride on her left leg. So we list that called dural torque to the left, okay, meaning that she's got a longer stride on the left leg and right arm. Okay, so what I would do is I would do a muscle test with the patient where I'd lay the patient on their side and I would test a muscle. I just choose to test this lat, and it's really strong. So now I'm going to put them in a simulated gait pattern on the table. This arm going forward and this over here. Okay, so now hold your arm real tight, resist. So she's pretty strong there. Okay, but now if I come over to this side and hold this arm here and lift up this leg and put this arm forward. Now, if I was to test her here, she would go weak. Okay, and the reason she's going weak is because she's taking too long of a stride with this leg and this arm. So the neurology, as soon as I put her in that position, freaks out, it gets too much tension to it, like an overriding of a computer. Any muscle you test is going to temporarily just trigger weak. Okay, so that tells me that she's walking too long with a stride here, and that matches what I saw when she was walking with this gait pattern. So what we'll have her do when she walks is walk with a longer stride here and here, and that'll accentuate that and de-accentuate the opposite side. Now, when we check for switching, okay, switching is we're checking pattern here. We check any muscle. Again, I just choose to use this one over here. Okay, what we'll do is we'll rub a couple points here right underneath the collarbone and on the belly button, and typically if a patient switches, that arm will trigger weak. So to clear that, what we do is we rub these really briskly, okay, and the other thing we'll check for is what's called an ocular lock. So follow my finger with your eyes. Okay, now let's say you hold your eyes here, and now the arm goes weak. That means that her visual reflex and her neck reflex will start to over-trigger when she turns her head or her eyes to the right. Okay, now, if we see that, okay, and then we'll have her follow her eyes over to the other side, look over here, okay, and then hold. If this is strong, then that means that we have to do a mechanism or an exercise to train her, which we would call cross-crawl pattern to the right, where we would have her turn her head to the right, lift her arm, and lift her opposite leg. So we're going to do an opposite crawling pattern. I'll show you how we do that, okay? Was yours initially, I know you're not switched now, but was it initially, you were doing it to the right? Okay. All right, the other thing we can check here, doctors, is we'll check the psoas muscles, okay? We'll take the feet and we'll turn them inward, okay? And typically what you'll see is you'll see that foot turning in a little further, and that's usually the side that they got to do that with, okay? Okay, so basically, I usually start a patient with their knees bent like this, and let's have you go through the exercise. And the exercise would be if we're lifting the opposite arm and leg, turn your head and look at your hand with your eyes. On the other side, you don't turn your head at all. You just keep it. Okay, so go ahead and do a couple. See how she's turning her head and look at her hand with her eyes? Okay, and we'll have them usually do about 25 to 30 of these twice a day. And again, if we have patients with dyslexia, problems with ADHD, the repatterning the nervous system makes them think a lot more clearly when they do this. So you need to go to a chiropractor that does this kind of work that will actually be able to test which side to do. Okay, really good. Now, why don't we do this? Let's have you get up and let me have you walk in this direction. Come on up. Okay, so now what we're going to show you is Roxanne's going to actually do the exercise for the gait pattern. Okay, once again, she was taking a longer stride with her left leg and right arm. Okay, so now what we're going to do is have her walk with a longer stride with her right or left arm and right leg. Okay, now a lot of times when a patient is first starting out doing this, it is really a lot more difficult than you would think, because we don't think about walking. It just becomes like a natural type of thing. But if your neurology is all screwed up and the gait patterning's off, then you have to the patient has to actually stop and mechanically or educatedly think about how to walk and retrain until it gets back into a normal pattern. Was that accurate?
That's true.
Okay, so go ahead and you're going to start walking with a longer stride on that side. Go ahead and do that. Now you'll notice how she's walking with a longer stride on her right leg and left arm. And she'll walk like that for probably a good quarter of a mile to a half a mile. Okay, that's good. Okay, so what we've done now is we've gone ahead and we've adjusted her knees, we've adjusted her feet and ankles. Okay, so we're removing pronation, helping plantar fasciitis, we're helping the knees, we're helping the hips, and all this is going to transmit into the gait. We will also be adjusting her upper neck, which is going to help center the messages where we would typically do a neck adjustment or antlerless adjustment. But the most important thing I want to show you here was, number one, the neurology of gait patterning. And the second thing, the switching patterns, which can affect your patient both emotionally and both physically, because what will happen is it'll throw the gait patterning off. So after this adjustment, what we want to do is have her walk a little bit and see what kind of changes that she's observed. Why don't you go ahead and walk over there and tell me what you see that's different. Now notice her heel strike. Look at her heel strike. Now come on, before she was toe striking first, look at her heel strike. What did you notice different after your adjustment here in terms of your gait?
Well, my left foot seems to have more fluidity. Like when I take a step with my right foot, it starts with my heel and goes to my toes. Mm-hmm. So now I have I'm a little more able to start with my heel and end up on my toes, more of a movement rather than a clump.
Right. So, and that's what we were noticing with those adjustments. Now, see, once again, what we're doing is we're firing the neurology in such a way that when she gets up to walk, and one of the most important things you could do after your adjustment is walk, because it's going to fire it's going to fire the neurology back and get that used to it. So doctors, you always want to have your patients walk after the adjustment, but you can notice a huge difference with her. I mean, she can see the difference, and it was pretty evident how she was heel striking versus toe striking first, and she had more fluidity in that. That's the power behind the adjustment. So I wanted to make sure that you got some great information over here, doctors, number one, on how to manage gait issues as a result of neurological imbalances from brain traumas and things like that. And patients that are out there that are examining or that are seeing this kind of stuff, make sure you get a chiropractor on your healthcare team that does this type of work. Doctors, we have courses on this type of stuff where you can look up on our website or call our clinic number. But I want you to also to notice the power of the gait patterning from the switching type of thing. If a patient is switched, their gait is never going to be normal, so it's really important that we clear out the switching patterns as well and give them the proper exercise that they can do on a regular basis, because these are long-term types of things, but the amount of strides that she has made since she has come in here is absolutely paramount. So it's really, really important, in addition to physical therapy and all the other things a patient would do for this, is to get a chiropractor on their healthcare team. I want to thank you for joining me for the chiropractic approach to this. Dr. Dennis Nikitow and Roxanne. Thanks again, and we'll see you next time.